URB-HealthS is an innovative educational program about urban health designed for municipal officials and professionals. Cities have been shaped by health issues from the very beginning of modern urbanism. Natural lighting and ventilation in housing, green spaces for recreation, and improving infrastructures such as water and sewage were introduced in cities in order to assure better and healthier environments to live. However, once communicable diseases were relegated to a secondary frame thanks to medical advances and hygienic measures too, non-communicable diseases became one of the major public health problems by the beginning of the 21st century. In this sense, cardiovascular problems, diabetes, respiratory diseases, mental health, depression, loneliness, cold and heat strokes, traffic accidents, or falls were directly related to urban environments and design. Modern urban lifestyles are based on unhealthy patterns that also affect the sustainability of the environment and the planet. It is evident that the apparition of COVID-19 as a communicable disease has highlighted health problems in urban contexts. But the truth is that cities have a lot to do to improve and provide healthier and more inclusive environments for all. In fact, the impact of this kind of epidemics has major negative consequences on the private neighborhoods, which already were facing the major health problems, worse quality of life, and even higher rates of mortality. It is so a historical moment to address health from an integral and interdisciplinary perspective. URB-HealthS project addresses this issue from an interdisciplinary point of view to create training material for policymakers, technicians, and professionals so they can take appropriate action. The first phase of the project consisted on an international survey to experts to identify which policies, regulations, indicators and methodologies, action plans and best practices could be part of the training contents. These results will be included in the training programs adapted to the local context by each working group. The material includes both theory and a practical workshop and is designed to be useful for local government officials from different areas. In this sense, it is important to note that even health is a transversal and common issue all across the world and shared by many countries in Europe. Its consideration as a major public priority is not always included in all the policies, especially those which concern urban design. URB-HealthS first edition will be validated in 3 European cities, Coimbra, Alcorcón and Newcastle. The partnership is integrated by Universidad Politécnica de Madrid in close collaboration with the Public Health Department of Madrid Regional Health Ministry, Newcastle University, University of Coimbra, Instituto Politécnico de Coimbra and International Consultancy Europe. Further editions can be requested, as well as training in other countries. Together, we will create a sharing knowledge, methodologies and best practice to deliver healthier communities and cities across Europe.